Hi everyone, my name is Stephanie and I'm the PGY2 Pharmacy Admin Resident. And today we're going to be highlighting the Meds to Beds program. And we have here Noah Farinas, who is the Meds to Beds technician. And I'll just have you start off by telling us what the Meds to Beds program is and what is your role as a technician.
Yes, thank you. So the Med to Bed program is a program that allows the patients who are getting discharged from the hospital, if they're going home, we can deliver their discharge medications at bedside without them having to go out and go to another pharmacy and wait in line and just so we try to just kind of exclude that out from their way home.
And so when you're up there delivering the medications to the patient rooms, is there anyone there providing them patient counseling or answering any of their medication questions?
Yeah, so usually we have a fourth-year pharmacy student who is in training, so they're the ones to go up with me and they do the counseling. If not, we have one pharmacist that is designated to do counseling at bedside if they're free.
Oh, that's great.
And if there isn't any pharmacist that is available downstairs, I would go up and then call down to the pharmacist to go over medications with the patients just to ensure they get that proper teaching.
Oh, that's great. Has there been any feedback that the program has received so far, either from patients or members of the healthcare team?
Yeah, so a lot of the staff find it pretty amazing that meds are delivered to them at bedside, and also again, there's been many patients who also thought it was a relief to have this done, and I feel like it takes off a lot of stress from those patients who are just trying to get home.
Are there any things that you want to highlight or some of the key accomplishments that's happened ever since the opening of the Meds to Beds program?
Yeah, so from the start of Med to Bed, from what I can remember about 3 years ago, we were only doing 2 floors, and now we expanded to I think almost 9 floors, and now we're also doing the deliveries to dialysis patients who are in the basement.
Oh, okay.
So getting to get in relationship with them because we're constantly seeing them on like a weekly basis or a monthly basis. So I get to establish like relationships within the staff and the nurses and the patients. So now we're up to delivering about almost 40% of patients that are getting discharged from the hospital.
That's great. Are there any goals or vision that you have for the program in terms of expanding our pharmacy services?
Yeah. So one of the main goals is to have practically all the staff that's working in the pharmacy trained to do med to bed deliveries, because we want the staff to feel comfortable that they can go up there to deliver and they're capable of doing that. And essentially if we can get that aligned, then we can essentially have more people and create more floors, so we can possibly have PACU being delivered to, which we don't right now. All the ICU units we don't deliver to, so hopefully we can establish like a delivery system with them as well.
That'd be great. Okay, well, thank you so much for your time.
No problem, thank you.
That's what we have today for the Meds to Beds program.